Your blood pressure may be climbing for a reason no salt shaker can fix. And after 60, one missing vitamin can quietly push those numbers higher. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day, and the next one could be the one your body really needs. Over the years, one pattern keeps showing up in older adults with stubborn blood pressure. They cut back on salty foods, they walk more, they take their medicine, and still the numbers stay higher than they want. Then blood work shows the same missing piece again and again: vitamin D. Today I'm going to show you when this vitamin may help, when it may not, and how to use it without making a common mistake. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think high blood pressure is only about salt, stress, or genetics. Those matter, yes, but they are not the whole story. Your blood vessels are living tissue. Your hormones talk to them. Your kidneys talk to them. Even your vitamin levels can affect how tightly those vessels squeeze. Did you know that? Here's the thing. Vitamin D is not a blood pressure drug, and I want to be very clear about that. It is not a replacement for your medicine. It is not a magic fix. But it may be a missing support tool, especially if your level is low, you are older, you carry extra weight, or you spend a lot of time indoors. A 2020 analysis of 27 randomized trials found that vitamin D did not meaningfully lower blood pressure in the general population. That sounds disappointing at first, but look closer and the story changes. The same body of research suggests the biggest benefits may show up in the people who start off low, not the people who already have enough. That is a huge difference. And that brings us to the real myth. More is not always better. Not a miracle pill, but a missing piece. Not for everyone, but possibly for you. A 2024 study from the American University of Beirut Medical Center followed 221 older adults with overweight or obesity for 1 year and found that vitamin D supplementation was linked with lower blood pressure, but the higher dose did not give extra benefit over the lower dose. In other words, steady and sensible may beat megadosing every time. Why does this happen? Think of vitamin D like a traffic cop for several systems that affect pressure. It helps regulate a hormone system called the renin-angiotensin system. That is just your body's pressure control system. When it gets too loud, your blood vessels tighten and your pressure goes up. Vitamin D may help keep that system from overreacting. It also seems to help your blood vessels stay more relaxed, more flexible, and less irritated. Like oil on a stiff door hinge, not a new door, just smoother movement. And here's the shocking part. The NIH says almost 1 out of 4 people have vitamin D levels that are too low for good health. Older adults are at even higher risk because aging skin makes less vitamin D from sunlight. So if your pressure has been hard to manage, would it make sense to at least ask if this missing piece could be part of the reason? Number 5, it helps the pressure system, not just your bones. Most people think vitamin D is only for bones, but actually your blood vessels, kidneys, muscles, and immune system all use it too. That matters because blood pressure is not just a number on a cuff. It is the result of many body systems working together. A 2024 study from the University of Navarra followed adults for more than 12 years and found that people in the highest vitamin D group had a 30% lower risk of developing hypertension than those in the lowest group. Now, that does not prove vitamin D alone caused the difference, but it tells you something important. Low vitamin D and high blood pressure keep showing up together. So what do you do with that? First, stop thinking only about your bones when you hear the words vitamin D. Start thinking blood vessels, heart workload, muscle strength, and balance too. Second, if you already take blood pressure medicine and your numbers are still bouncing around, do not just shrug and say, that's aging. Ask whether your vitamin D has ever been checked. Why guess when a simple test can give you an answer? Third, do not chase huge doses because you heard someone online say, more is better. Your body does not work like filling a gas tank. It works more like watering a plant. Too little is a problem. Too much can also be a problem. But wait until you see number 4 because this is where most seniors realize why they may be low in the first place. Quick question. Have you experienced dizzy spells, muscle weakness, or blood pressure readings that seem all over the place? Comment yes or no below. Number 4. The people most likely to be missing it. Most people think vitamin D deficiency only happens if you never go outside. But actually, many older adults can be low even if they take short walks, eat fairly well, and feel fine. Why? because your skin makes less vitamin D with age. Extra body fat can also trap vitamin D and make it harder to use. Darker skin tones make less vitamin D from the same amount of sun, and if you live in a colder place, winter can cut your vitamin D production way down. A 2024 study from the Norwegian University of Science and Technology using Norway's Hunt data found that higher vitamin D levels were linked with lower blood pressure in cross-sectional analysis. Each 25 nanomoles per liter increase was linked with about 1.7 millimeters of mercury lower systolic pressure and a 19% lower prevalence of hypertension. But the same study also showed that genetics did not prove a clear cause and effect link. That is very important. It means low vitamin D may be part of the problem, but not the whole problem. So who should pay extra attention? If you are over 70, carry extra weight, stay indoors a lot, cover most of your skin outdoors, or have had low vitamin D before, you are in the group that should be more alert. If you have gut problems that affect absorption, that matters too. If you have been told you have osteopenia, osteoporosis, or weak muscles, that is another clue. Here's a simple check-in. Ask yourself this: do you spend most mornings inside? Do your legs feel weak for no clear reason? Do you avoid fish, fortified dairy, and eggs? Do you live where winter drags on for months? If you said yes to 2 or 3 of those, your risk is not small. What should you do today? Write down your risk factors before your next doctor visit. Not in your head, on paper. Say, I'm older, I'm indoors a lot, and my blood pressure has been stubborn. Should we check my vitamin D? That is a smart question, not an extreme question. But wait until you see number 3, because this is where you can start helping your level without making your routine complicated. Number 3, food first still matters. Most people think you can fix this with a pill alone, but actually food gives you a steadier base. And for many seniors, that base is weaker than they realize. The problem is not that vitamin D foods do not exist. The problem is that most people do not eat them often enough. Let me make this easy. 3 ounces of cooked rainbow trout gives about 645 IU of vitamin D. 3 ounces of cooked sockeye salmon gives about 570 IU. Half a cup of UV-exposed mushrooms gives about 366 IU. 1 cup of fortified milk gives about 120 IU. 1 serving of fortified cereal gives about 80 IU. 1 large egg gives about 44 IU, and the vitamin D is in the yolk. 2 sardines give about 46 IU. Do you see the pattern? A little here and a little there adds up, but most breakfasts and lunches still come up short. A 2024 study from the American University of Beirut Medical Center found that older adults with overweight who used vitamin D over time saw blood pressure come down, but taking more did not mean doing better. That should tell you something. Your goal is not a giant dose. Your goal is a steady habit. So here's a very simple food routine. 2 mornings a week, have fortified cereal with fortified milk and 1 egg. 2 lunches a week, use salmon, trout, or sardines. Add mushrooms to soup, eggs, or stir-fried vegetables. If you do not like fish, try fortified milk, fortified yogurt, and eggs more often. Not fancy, not expensive, just consistent. And let me be clear, food alone may not be enough if your level is very low, but food is still the floor. It keeps you from relying on a bottle for everything. It also helps you build a routine you can stick with. What good is a perfect plan if you quit after 4 days? Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, supplements help most when they are done the right way. Most people think the answer is to buy the biggest bottle with the biggest number on it. But actually, vitamin D works better when it is matched to your need, taken regularly, and used with patience. More is not stronger. More is sometimes just more. Adults over 70 generally need 800 IU a day as a basic target. That is the standard amount many experts use for older adults. The daily upper limit for most adults is 4,000 IU unless your doctor tells you otherwise for a short time. So if you are taking 5,000, 10,000, or 20,000 IU every day without blood work, that is not being proactive. That is guessing. A 2022 trial from the Medical University of Graz looked at people with hypertension and low vitamin D and found no significant drop in 24-hour blood pressure after short-term vitamin D treatment, even in very low groups. That may sound discouraging, but it teaches an important lesson. Vitamin D is not instant. It is not for everybody, and it works best as part of a bigger picture, not as a rescue pill. Here is the smart way to use a supplement if your doctor agrees. Choose vitamin D3. Not a random blend with 10 other things you do not need. Take it with a meal that contains some fat, because vitamin D is absorbed better that way. Breakfast with eggs, lunch with yogurt, or dinner with salmon all work better than taking it on an empty stomach. Keep the dose simple. Take it at the same time each day. Give it time. Think 8 to 12 weeks, not 2 days. And please do not stop your blood pressure medicine because you start vitamin D. That is a dangerous mistake. The right mindset is this: not replacement, but support. Not overnight, but over time. But number one is the most important part of all because it stops you from guessing. Number one, test it and track it. Most people think they can tell if vitamin D is low by how they feel. But actually, many people with low vitamin D feel almost normal until the weakness, aches, or balance issues get worse. And many people with high blood pressure also feel normal. That is why guessing fails twice. The blood test you want is called 25-hydroxyvitamin D. That is just the main storage form your doctor uses to see where you stand. Pair that with a simple home blood pressure log. Why? Because what matters is not just your vitamin D number. It is whether your pressure improves over time while you make careful changes. A 2024 study from the Norwegian University of Science and Technology showed why this matters. Vitamin D looked helpful in one kind of analysis, but the deeper genetic analysis did not prove that vitamin D alone causes lower pressure. So the smartest move is not blind faith. It is measured action. Here is your step-by-step plan. Ask for the blood test. Then check your blood pressure at home for 7 days. Sit quietly for 5 minutes first. Feet flat on the floor. Back supported. No coffee or smoking for 30 minutes before. Take 2 readings, 1 minute apart in the morning and evening. Write them down. Then start your food routine and supplement plan if your doctor agrees. Recheck your pressure over the next 8 to 12 weeks. Recheck vitamin D when your doctor recommends. That is how you learn what is really helping your body. I'd love to hear your story. What made you click on this video today? Share in the comments. Now let's pump the brakes for a second. I'm not saying this to scare you, but vitamin D can cause problems if you overdo it. Too much can raise calcium in your blood. That can lead to nausea, confusion, constipation, weakness, kidney stones, heart rhythm trouble, and in severe cases, kidney damage. So please respect the dose. You also need to be careful if you take certain medicines. Thiazide water pills, also called thiazide diuretics, can raise calcium too much when mixed with high-dose vitamin D. High doses can also be risky with digoxin, some blood pressure medicines like diltiazem or verapamil, and certain other drugs. If you have kidney disease, a history of kidney stones, high calcium, sarcoidosis, or parathyroid problems, do not self-treat. Talk to your doctor first. And if your blood pressure is suddenly very high, if you have chest pain, severe headache, shortness of breath, weakness on one side, or trouble speaking, do not wait for a vitamin to help. Get medical care right away. Vitamin D is a slow tool. Emergencies are fast problems. So you're convinced but thinking, how do I actually do this? Start with the simplest option. Ask for a vitamin D blood test. Add 2 or 3 vitamin D foods to your week. If your doctor agrees, use a basic vitamin D3 supplement in a sensible daily dose. Take it with food. Track your pressure at home. That is it. If money is tight, go budget first. Store brand vitamin D3 works fine. Fortified milk is usually cheap. Eggs are cheap. Canned sardines are often cheaper than fresh fish. Even fortified cereal can help fill the gap. You do not need a trendy brand, a giant tub, or a complicated routine. You need consistency. Look, there's a lot of noise out there. Some people say vitamin D changes everything. Others say it does nothing. The truth is usually in the middle. Vitamin D may help lower blood pressure more than you think if you are older, low in it, heavier, indoors a lot, or already dealing with hypertension. But it is not a magic cure, and it works best when you stop guessing and start measuring. You don't need to overthink this. Start with just one step. Ask for the blood test or begin a 7-day home blood pressure log. Your body will tell you if it's working, but only if you give it a fair chance and track the numbers. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong,